WholesomeCo Cannabis Pharmacy in Bountiful has 2 on-site pharmacists, Mindy and Kylee. They also are set up with 2 soundproof booths that are quite roomy, which will have a computer screen in them and be set up for telehealth appointments with other pharmacists should there be more patients waiting to get processed in. Here's my introduction with Mindy Madeo. WholesomeCo, and we are going to do our pharmacist consult in a private room.
Okay.
I want to make note of that because Perfect Earth has you sit right out in the open area.
Yes,
behind a glass window.
Yeah, I think their pharmacy is a little bit small, so they don't have the luxury of an office. Tell me why you're here. What are you treating?
I'm going to shift gears with that.
Okay.
And so I first just want to do a couple of questions
Sure.
for you.
Sure.
I know from your radio or your podcast interview that you already have quite a bit of expertise with cannabis and that you've registered for the Masters program.
Yes, I'm so excited for that. That starts on August 20th, and which is coming up pretty soon.
Okay. Have you heard of anybody besides Corey Anden that's jumped on board?
No.
So the 2 of you are going to be our highest educated cannabis providers in the area.
That is correct. And I actually live kind of near Corey, and so we've become friends, and we go hiking sometimes, and we talk about cannabis the whole time. So I'm excited to go to school with her. She's very smart.
Okay, good deal. I also am curious because I just heard that there's more than 2 pharmacists here.
Yes.
7?
We have got 2 full-time pharmacists that are going to be at the pharmacy all the time, me and Kylee. And Kylie's an exceptionally bright pharmacist. She has a lot of lab experience, so she used to run a compounding pharmacy. And we're going to use her a lot for products, and especially when we start to cultivate and process, we're going to probably stick her in the lab, and she's going to come up with a lot of our product ideas, and she's really smart too.
Are you going to, at that point that you get your lab, then also be employing pharmacy techs along with?
No, and right now, so besides me and Kylee, we do have 5 other pharmacists that work from home. We want to make our pharmacists really available. So I don't know if you saw those rooms out there, those little tiny phone booths.
Oh, I did.
Yeah, so we're going to make it so there can be somebody get a consultation inside this office,
Or they can do
as well
telehealth.
as 2 telehealth. We'll have 2 pharmacists on call most of the time. And then if anyone has questions, they can call from home. If anyone's homebound and needs delivery, they can call for home. Especially with COVID, we wanted to make sure that we're really convenient and accessible. And we were even thinking about hospice patients too. There's
are not mobile.
Yeah, and there's a real problem getting those patients with letters seen quickly. Right now we have to have them come in their car, and it's unfortunate when they can't really get out of bed. So we're trying to figure that out. But yeah, and then we have, instead of pharmacy technicians, we have agents, and a lot of our agents used to be pharmacy technicians that me and Kylee worked with. So we brought a variety of different agents. One is from, one worked at a dispensary in Las Vegas that was very busy and popular, called Reef Dispensary.
That's a big one.
So she's very experienced. Her name is Rachel, and then we've got a number of other agents that are either technicians, or we kind of knew them. I think some of them are psychology majors. They just graduated college. So we've got we have a great staff, really educated, very medical. So it's exciting.
Okay, I'm going to go ahead and thank you for that information.